Hey everyone, and welcome back to the show. If you like these legislative updates, be sure to hit that like button and subscribe to the channel. 99% of you watching haven't subscribed yet, so if you're enjoying the content, please consider helping us out. All right, so for everyone tuning in to stay up to date on the bills affecting veterans, we've got a lot to go over this week.
Yeah, it's been a busy week up on the Hill.
6 bills, to be exact. We're going to cover S2513, the Veterans Benefits Improvement Act of 2024, S141, the Senator Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act.
That's a mouthful.
It is. We've also got H.R. 7365, the VETS Safe Travel Act, H.R. 92516, the Military Families National Parks Access Enhancement Act, and then there's S-Con Res 23, which is about designating September 29th as Veterans of Foreign Wars of the United States Day. And finally, H.R. 1097, the Everett Alvarez Jr. Congressional Gold Medal Act of 2023.
Let's kick things off with H.R. 1097, since it's already passed through the Senate and is just waiting for the president's signature.
Okay, sounds good. So this one awards a Congressional Gold Medal to Everett Alvarez Jr. I'm guessing some people listening might not know who that is.
Yeah, his story's not one you forget easily. Everett Alvarez Jr. was the first American pilot to be shot down and captured during the Vietnam War.
Okay.
He spent over 8 years as a prisoner of war, 8 years. But even in those conditions, his resilience, his leadership were just remarkable. He organized a resistance among the other POWs, really helped to maintain morale and hope in a really, really tough situation.
Wow, that's incredible.
It is. And, you know, his service didn't end when he was released. He's continued to serve our nation in several different roles. Government positions, advocating for veterans' rights, really embodies the spirit of this award.
So a Congressional Gold Medal, very well deserved, it sounds like. All right, so let's move on to S-Con Res 43, which establishes a Veterans of Foreign Wars of the United States Day.
Straightforward one, this one. It passed the Senate after an amendment was proposed, and it aims to designate September 29, 2024 as a day to honor the VFW.
So for those who might not know, what is the VFW? It's obviously a veterans organization. But what's the point of having a day like this?
It's all about recognition. Recognizing the sacrifices that these veterans have made and raising public awareness. You know, the VFW does a lot. They have millions of members, and they offer all these programs and advocacy initiatives. They help veterans and their families. So a day like this, it just shines a light on all that good work.
So it's like a symbolic gesture, but it's also a way to highlight all the resources that are out there.
Exactly. Okay, so let's move on to a bigger bill now. This is S141, the Senator Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act. This one's got a lot in it, so we'll just focus on the key points for you.
Sounds good.
So first off, it addresses access to care. The bill aims to improve appointment scheduling both within the VA and through community care providers. There's a big push for same-day scheduling, for phone calls, and giving providers incentives to quickly return medical records.
So it's trying to cut down on those long wait times that veterans often face?
Exactly. Then there's a big focus on value-based care.
What does that mean again?
Value-based care is about moving away from simply the number of procedures performed. It's about making sure veterans get treatments that actually work and lead to positive health outcomes.
So it's about making sure that veterans are getting better, not just getting treatments that may not be effective.
That's the idea. The bill mandates a strategic plan to implement value-based care within the VA system, and it even suggests maybe bringing in some expertise from the private sector.
Interesting. Drawing on different perspectives.
Right.
What sort of impact do you think this kind of shift to value-based care could have for veterans?
Well, if it's done right, it could really improve veterans' experiences. Think about it. Easier access to appointments, shorter wait times, treatments that actually work and lead to better health. It tackles some of the major issues veterans face with the VA, and it shows they're thinking about their health care holistically.
Yeah, it sounds promising. What about mental health support for caregivers? That's something this bill looks at too, right?
Yes. S141 acknowledges that caregivers are vital, and it recognizes that caring for a veteran can take a toll on their mental health. So the bill proposes grants to improve access to mental health services for these caregivers.
It's so important we often overlook that. Providing good support to caregivers ultimately benefits veterans as well.
Absolutely. The bill really highlights that connection between a veteran's well-being and the well-being of their support system.
So S141 is taking a pretty comprehensive approach to improving things for veterans and their families. What else is in this bill?
A few other notable provisions worth mentioning. For instance, it aims to expand eligibility for the Frye Scholarship, which helps surviving spouses and children of those who died in the line of duty. And it calls for a pilot program to offer dental care to veterans with ischemic heart disease.
Interesting. I've noticed more attention to dental care for veterans lately.
Yeah. People are realizing that dental health is connected to overall well-being. It can have a big impact on other health conditions.
That makes sense. Okay, so S141 is a big one, with the potential to change a lot. What are some of the challenges or concerns you see with this bill?
Well, one of the biggest challenges with any big change in the VA system is implementation. How do we make sure these provisions are implemented effectively,
Mhm.
efficiently, and fairly across all the VA facilities? That's going to take careful planning, good resource allocation, and ongoing oversight to make sure veterans are actually benefiting.
It's like that saying, the road to hell is paved with good intentions.
Yeah, exactly. And then there's the concern that this focus on value-based care doesn't unintentionally create barriers to care or limit the treatment options veterans have. It's about finding a balance between cost effectiveness and making sure veterans get the best possible care for their needs.
I see. So it's about making sure that these changes are really centered around the patient and that they don't backfire and have negative consequences.
Right. It's going to be important to monitor how these changes are implemented and what their impact is to make sure they're doing what they're supposed to do.
That sounds like a wise approach.
Yeah.
Okay, well, S141 is definitely one to keep an eye on. Now let's move on to S2513, the Veterans Benefits Improvement Act of 2024. This one's focused on benefits rights.
Yeah, this one's all about veterans benefits, and it has a really important section on burial allowances for veterans who die at home receiving hospice care.
Okay,
This could be huge for families who are dealing with a loss. It can offer some financial relief during a really tough time.
that's important. What else?
Well, there's also a section on grants to states and tribal organizations to help them improve their outreach to veterans.
Okay.
The goal here is to make sure that veterans know what benefits they're entitled to. They've earned these benefits through their service, so we need to make sure they can access them.
All right, so S2513 is about making sure veterans get the benefits they deserve, both in life and after they're gone.
Exactly. Okay, let's talk about HR 57365, the VETS Safe Travel Act.
All right.
This one focuses on covering the cost of ambulance transportation for veterans in certain situations.
Ambulance transportation.
Yes. So it covers ambulance transportation costs up to $46,000. This could be a big help for veterans in rural areas or those who need emergency care far from a VA facility.
Yeah, that makes sense. What kind of situations are we talking about specifically?
So let's say a veteran needs to be transported from a non-VA facility to a VA facility because the care they need is authorized by the VA, but it's not available at that non-VA facility. Or let's say a veteran becomes incapacitated and needs to be taken to the nearest suitable medical facility. Those are the kinds of situations where this bill would kick in.
So it's about making sure that veterans can get the care they need when they need it most without having to worry about how they're going to get there or how they're going to pay for it.
Exactly.
Okay, let's move on to HR 9516, the Military Families National Parks Access Enhancement Act. This one's all about giving military families free access to national parks.
It is, and it really ties into this broader idea of recognizing the sacrifices that military families make. It's a small gesture, but I think it can make a big difference.
Absolutely. Our national parks are incredible. They're a part of what makes our country so special. And giving military families the opportunity to enjoy them for free just feels right.
Agreed.
All right, so those are the 6 bills we wanted to cover today. We've talked about everything from healthcare to benefits to transportation to recognizing the sacrifices of veterans and their families.
It's a lot to take in, but hopefully this overview has been helpful for you.
Absolutely. And for those of you who want to dive deeper into the specifics of these bills, we'll be sure to include links in the show notes.
Yeah, please do.
Now, listening to all this, it makes you think about all the untold stories out there. Stories of veterans who are doing amazing things every day, stories of resilience, of service, of dedication. It's inspiring.
Absolutely. There's so much we can learn from veterans.
Absolutely. Well, that's all the time we have for today. Thanks for tuning in.
Thank you.
And don't forget to like and subscribe so you don't miss our next legislative update. We'll see you then.
See you next time.